Welcome everybody, my name is Jared, and I'm the developer of RT Tutor. This is a YouTube channel where I'm going to be providing you information related to the respiratory system, respiratory therapy, and healthcare in general. So, since we're going to be focusing on respiratory, this is going to be the launch video. So what do we want to talk about first is, what is a respiratory therapist? So the respiratory therapist is a specialist that works with the respiratory and cardiopulmonary system, and they work with patients to prevent, identify, treat acute and chronic respiratory illnesses, and they provide patient education. And this education is usually disease specific to respiratory, so they'll be teaching patients with COPD about how to manage their disease, or patients with asthma how to take their medications, how to manage their disease, or somebody that requires a ventilator at home, they're going to be teaching them how to take care of themselves at home and work with that machine. So where are the respiratory therapists found? Most respiratory therapists work in acute care hospitals. So they work in the intensive care units, running ventilators, giving medications to critically ill patients. They also can work in diagnostic labs. They're performing mainly lung tests on people to tell how well their lungs are functioning or how poorly their lungs are functioning, how well they're responding to their medications, their care plans, and disease-specific related things. They can work in sleep centers, in which they diagnose sleep apnea mainly. And they can work in rehabilitation centers, long-term centers, skilled nursing centers. These are with patients with significant disabilities that require 24-hour care, or maybe they're on a ventilator all the time, or they have what's called a tracheostomy, and they need a specialist to help take care of these patients. They also can work in home care for the patients that are able to go home with these tracheostomies or ventilators, or if they're diagnosed with sleep apnea, if they have a sleep apnea machine, they can go home and help these patients. Some of them also work in patient transport, so they're transporting very critical patients that mainly require what's called mechanical ventilation, so they need help breathing because they're so sick they can't do it on their own anymore. A few might work in wellness centers, and a couple more work in medical device companies. So they're the companies that work to do research or to develop new machines or treatments and ventilators and all that good stuff. And some of them also can work as teaching. So we're going to start with, how does one become a respiratory therapist? So if you're watching this video, you're either a patient, you might be somebody who's thinking about what they want to go to school for, or they're just, curious about what this guy running around in the blue scrubs is at the hospital. So a respiratory therapist, to become one, the minimum requirement is you have to get an associate degree from a school that is accredited by what's called COARC, and this is the Commission on Accreditation for Respiratory Therapy, or Respiratory Care. And these are the guys that come in and say, your school provides the minimum education required for us to allow you to go out and work with patients in the real world. So most of these programs are associate degree based. Some of them, when you graduate, they're actually bachelor's degree programs, and even other schools offer what's called a bachelor's degree completion program. So for these programs, you have your associate degree, you're licensed, you're working, and you're taking extra credits to show you care about your education, and this is coming very popular since the American Association of Respiratory Care recently said that their big initiative for 2020 is that all of their respiratory therapists in the United States should have a bachelor's degree to practice. So we're going to be hearing a lot about that in the near future. And there are some master's degree programs out there, but most of them are management type degrees, and they don't really focus on any type of advanced practice. So respiratory therapy school, you can take this at a community college, you can take it at a university, trade schools. Some programs are offered through a joint program through hospital systems, and you're going to be taking classroom work. You got to get in the classroom and learn the basics before you can work with patients. You're going to be doing some lab skills, so you're going to be playing with machines when they're hooked up to test patients or test lungs, and learning how they work and getting to play with them a little bit and just understand the equipment. And you're going to be having clinical experiences, so you're going to get in the hospitals and you're going to work with patients. So these are the general type classes that you'll be taking. First is you're going to take human anatomy and physiology. If you're going to work in healthcare, you got to take A and P. There's no getting around it. You have to prove that you know the basics about the human body to be able to provide healthcare. Some of your respiratory classes are going to get very in-depth about respiratory and cardiopulmonary physiology and pathophysiology. So you're going to learn about how the heart and how the lungs work together and how diseases can affect this process. So you're going to be taking microbiology because this is where diseases come from. You need to learn about the cells, you need to learn about the genetics. There's a couple genetic related or genetic based respiratory diseases out there like cystic fibrosis that you'll learn about eventually. You need to learn about how diseases are transmitted and how to prevent these diseases from being transmitted. You're going to need to learn how to sterilize things because a lot of the respiratory equipment is reusable, so you need to know how to clean it effectively. You're going to need to learn about immunology, which is about how your immunoglobulins work in your body and how allergies work. You're going to be taking chemistry classes because you got to take your chemistry. You're going to learn a little bit about elements. The big one is the O, oxygen. You're also going to learn about some chemicals, ions, solutions, and what's called the acid-base theory, which once you get into respiratory specific classes, you'll understand why that's so important. You got to take math. There's no getting around it. If you work in healthcare, you need to know math, which is mainly basic algebra. And physics is a very heavy part of respiratory therapy. You need to learn about fluid and gas behavior. A lot of respiratory therapy is related to what's called fluid dynamics. You're also going to need to know about some kinetic theories of matter, and you're going to learn a ton about P and T, which is pressure and temperature. And we'll get into that more, why it's so important to learn about your P's and T's a little bit later. So your classroom instruction is you're going to learn the basics, and then you're going to learn the advanced concepts of respiratory therapy. So you're going to learn about all of these machines and how they work with the patients to make them better. You're going to learn how to do cardiopulmonary diagnostic testing with big machines, with little machines, at the bedside, in the lab, through numerous settings. You're also going to learn about how to take care of patients in the critical care setting. You're going to learn about heart rate monitors, EKGs, blood gas monitors, or what's called point-of-care testing type monitors. You're going to learn at least a little bit about neonatal and pediatric concepts because respiratory therapy plays a very important part in resuscitating newborns and taking care of pediatric diseases. And you're going to learn about equipment. And you can see this picture. There's a lot of scary equipment there, but if you're a respiratory therapist, you can at least identify a couple of them on there that you still use, and I know some of those are outdated and probably aren't even manufactured anymore, but after you get through your school, you're going to understand what all of these pieces of equipment are, and you're going to learn to love some of them and hate an awful lot of them. So the laboratory, this is where you're going to get your hands-on practice with equipment, and you're going to be practicing stuff that you're going to be using every day when you go to work. And so you can see there's that little old lady there on the ventilator. That's kind of what you're going to be doing, is taking care of these patients while they're in bed, while they're hooked up to the breathing machine. Yeah. And moving right along. So your clinical experiences, these are when you're going to get into the hospital and actually work with patients, taking care of them, and learning more about how to be a respiratory therapist. So you're not working with your own license per se, but you are working under somebody else's license. So you have what's called a preceptor who's going to be supervising you very closely while you're in the hospital and making sure that you're practicing safely. This is a lot like on-the-job training, so that you're going out and you're doing the stuff that you'd be doing if you were working as a respiratory therapist. You're just getting a little extra monitoring and attention. And in this setting, you're going to be doing your patient assessments. You're going to be putting your stethoscope on the patient. You're going to be listening to their lungs. You're going to be observing how these patients act and how their conditions change over time. You're going to be understanding how to modify treatments and therapies. You're going to be learning how to document patient responses in the patient record or electronic medical records, which they're all turning into. And you're going to learn how to collect some samples. And another big thing you're going to be learning about is how to communicate with the rest of the healthcare team. So you're going to be learning how to talk to your doctors, your nurses, your pharmacists, the roles that each of these people play. and how they all work together fairly smoothly so most of the time to take care of patients. So the bachelor's degree level classes. So these are after you learn the basics, so you know how the lungs work, you know how a lot of the equipment work, but you need a couple advanced concepts. So you're going to be learning about research. You're going to have a class in your research. You got to learn how to critically approve research papers that are published to tell if they're applicable to your practice or if they're not really good enough to be converted into clinical practice. You're going to learn how to provide education and teaching, and this might be the teaching that you provide to your patients. It might be teaching in the school setting, so you can be an instructor of a respiratory program. It's also going to be focusing on management, so you're going to learn how to be a manager or a supervisor of a respiratory or healthcare department. And you're going to be taking classes in ethics, because a lot of what respiratory works with is related closely to bioethics, because the patients that are cared for by respiratory therapists in the critical care setting are very, very sick, and a lot of the times they do die. So you need to understand the ethics of that situation, what's right, what's wrong, how to deal with it, and how to take care of yourself when these situations arrive. You're also going to be learning about how to write for healthcare professionals. So this is in case you want to get into research and you want to start publishing your research. You got to learn how to properly cite your work. You got to learn how to conduct your research and how to do what's called disseminate your research or publish it and get it out there so others can learn from you. So there are a couple schools that offer a master's degree in respiratory therapy. Unfortunately, these are only offered as healthcare administrator, manager, or educator type degrees. A lot of people have been begging for what's called an advanced practice RT, and this is very similar to the neonatal or the nurse practitioner degree, but it's been very difficult to make any progress towards this, and a lot of it's related to politics, difficulties in licensure, state problems, because what they're searching to do is essentially create a healthcare profession that isn't around yet. So you can imagine a lot of people with the current way healthcare is set up is it's very difficult to make a healthcare profession when it comes to reimbursing or paying and safety and everything else like that. And with the way healthcare is in America right now, it's a little rocky, so it's very difficult to get respiratory therapy to the advanced practice level. But hopefully in the future it will happen, but who knows if it'll happen in my lifetime or the next. So how do you get your respiratory license? So after you graduate, you're going to do what's called sit for board, and this means you're basically going to go in and you're going to take an exam. So this exam is offered by what's called the National Board for Respiratory Care, or the NBRC. And they offer a couple examinations that you need to pass in order to get a license to go ahead and work. So the exam you take now is called the Therapist Multiple Choice Exam, or the TCM. It previously was offered as two separate exams, but now it is one. And this will give you your Certified Respiratory Therapist examination and your Registered Respiratory Therapist examination. You also can take other exams related to your specialty practice, and these tests are managed by a company called Applied Measurements Professionals Incorporated, or AMP, and they are actually conducted at H&R Block centers. So if you're taking your exams during tax season, it's going to be a little noisy and a little busy, but the rest of the year it's usually pretty quiet at those centers. And after you pass these exams, you put in an application with your state that you want to practice with. They contact the respiratory board, and the respiratory board tells them, "Oh yeah, Jim passed his exam. He's ready to get that license and work." And they say, "You got it," and they mail you back your approval and a number, and you're ready to get out in the workforce. So the CRT credential. So this is the entry level examination. So this is 160 questions, and you're scored on 140 of them, and 20 of them are there for practice, and these are pre-test items. So these test questions are ones that they might want to use in the future, but they want to make sure that the students taking the examination understand the question, that there are not any problems with them, that the questions aren't confusing. So it's kind of their way of researching future questions. So you have 3 hours to take this exam. And this exam is going to cover things like patient data and evaluation, how to make recommendations, how to troubleshoot equipment, quality controlling equipment, infection control, and when to start and change therapies. You're going to get a lot of basic information or questions on this examination. And when you take this examination, you're going to get three outcomes. You're either going to fail, which hopefully doesn't happen. You're going to get what is a low passing score, which is around 67% or 88 questions, and you can get a high passing score, which is 94 correct questions or about 82%. So if you get a low passing score, they send you a CRT, which you find out before you leave the center. You don't have to wait 3 weeks or whatever to get your scores in the mail. You find out as soon as before you leave the testing center. Or you can get your high passing exam, which will grant you the CRT and an eligibility to sit for the next level examination, which is the clinical simulation exam. So, in order to become the registered respiratory therapist, you have to do a couple things. So the basics is this is the standard of excellence in respiratory care. So there used to be a lot of different terms for what a respiratory therapist was. They began as oxygen orderlies and aerosol inhalation specialists, and it evolved over the years, but it came to CRT and now the RRT. RRT is the gold standard. We want everyone to be RRTs. We'll get into that a little bit later. But previously, you had to take 2 exams for this, but in 2015 it was changed to just a good score in that first exam and then passing the simulation exams. And you can take this any time after 3 years of graduating, and if you don't, you have to take that first exam again. Pass it, and then you're eligible for another 3 years. So the simulation exam is 22 scenarios that they're going to put you in. You have 20 scored and 2 practice items. You have 4 hours to take this examination. And these questions place you in the clinical situation with a patient situation. And they're designed to simulate reality, relevant practice, and what you'd be doing in real patients. So they're going to tell you things like you're working in the emergency department and you get a call from critical care transport that there was a motor vehicle accident and the patient has a Glasgow coma scale of this, and he was intubated with an endotracheal tube that was this big, and it's at this depth, and he's being ventilated in this settings, and his weight is this, and you have to say, is this all appropriate or not appropriate? And you'll make your choices, and based on your choices, you'll go to the next question that's going to ask you something based on your previous question, where it's going to say, okay, you made this change, things got better, something unexpected happened, just like the real world, what do you do now? And that's basically what that exam is, and you have to go through 20 of these scenarios, and when you get done, you need to get a 303 in order to be granted the registered respiratory therapist credential. So CRT versus RRT. So the big difference between these 2 degrees, other than just passing another test, is the pay. RRTs get paid more than CRTs regardless of their education. So if you have associate degree RRT or bachelor degree RRT, you're going to make more than a CRT, unless you're a CRT with 30, 40 years of experience. It's just how it goes. There's some people that will debate that RRTs provide better care. It's a big argument. It seems like a lot of people with CRTs like to pick on the new grad RRTs and tell us how much better they are than the RRTs and how they can run circles around them in patient care, but it's debatable whether they can or not. And RRTs are more likely to make more money during their career because more RRTs than CRTs are likely to advance to management positions or educator positions that come along with higher pays. So there's another examination you can take, which is the pulmonary function examination. So this is the guy that's going to be working in the lab testing patients' lungs. So there's 2 examinations, or 2 credentials available, which is similar to your CRT and RRT, which is the certified PFT and the registered PFT. So it used to be 2 exams, but in 2015, just like the RRT, they switched everything over because there was too many tests, and now there's just 1 test. and it gives you that high passing or low passing. And when you take the pulmonary function technologist exam, if you're a low pass, which you can have your three outcomes, which is a failure, a low passing score, and you get your CPFT, or a high passing score, which you get your RPFT. So eligibility for this exam is you have to graduate from a COARC approved respiratory therapy program, or you have to pass your CRT or your RRT, or you have to complete 62 hours of college credits, which is about a bachelor's degree worth of credits, because an associate's is about 30 and a bachelor's is about 60, and you have to have 6 months experience working in the hospital. So this is at least 8 hours per week. So you can't go and do 4 hours, every other week for 5 years and then say you're eligible to sit for this exam. You have to actually work with these patients, work with the equipment, understand what you're doing, and then pass this examination to get this credential. So this examination is a little bit lighter. There's only 115 questions on it, and there's 100, and there's 2 hours to take it. And you're going to be tested on the instruments, the equipment, how to calibrate the equipment, how to tell if your equipment's working properly, how to tell if it's not working properly. If something goes wrong when you're trying to calibrate it, how do you fix it? How do you tell it's not working right? And then it's going to take you through questions related to actually conducting the test. So you're going to be asked about how to do a PFT and test people's lungs with the big box, or what's called doing spirometry. You're going to be learning about doing bedside testings with some miniature, what's called pulmonary function testing devices that you can just take in the patient's room, where they don't have to come to the lab to get tested. You're also going to be learning about data management. So a lot of these pulmonary function equipment are computer related. So they input the information to the computer, and they're going to give you a lot of like graphic feedback. So you're going to need to learn a lot about how to interpret the data, what does this mean, and how can you improve it. And there's going to be a lot of questions about how to troubleshoot procedures. So if somebody is trying to test their lungs and they cough or they sneeze or something happens, how do you recognize that on a graph? How do you fix it? How do you help people? It's a lot about conducting these pulmonary function tests. And if you pass it, you get your low pass or your high pass and get your CPFT or RPFT. So these are the specialty examinations that you can take. These are an opportunity for you to basically show what you know. You're committed to what you're doing and you're a professional. You don't care that you have to study a little bit harder to pass another examination. A lot of these exams aren't required by your employer, so it shows that you're truly dedicated, that you want to be more than just the RRT. And a lot of employers are going to reimburse you for it. They're going to pay you for showing what you know because it looks good. A lot of respiratory departments out there will say, if it's a pediatric ones, they're going to brag how many people in their department have the pediatric specialist exam or credentialing. And so they're going to reimburse you for taking this test. They might give you a higher pay grade for it. A lot of places don't give you a higher pay rate, but it counts towards your overall professionalism and personal and professional development. And the NBRC offers two of them, which are the Neonatal and Pediatric Specialist exam and the Adult Critical Care Specialist. So the Neonatal Pediatric Specialist, or the NPS, is the test that covers neonatal and pediatrics. I know, go figure. The eligibility for this is you have to at least have your CRT and 1 year of NeoPeds experience, or you have to have your RRT and no experience. So a lot of people can go out and take this exam even if they don't have the NeoPeds experience, but it's kind of better to get your experience before you take this examination. That's a personal belief, but take it for what you want. So this examination is a little bit longer. There's 140 questions. You're scored on 120 of them. There's 20 of them that are pre-test. You got 3 hours to test it, or to take it, and it's going to be focusing on information as it relates to the neos and peds. So you're going to learn about clinical data that you can collect from neonates and pediatrics. So you're going to be learning about, or you're going to be tested on what's called the APGAR scores, which if you're an adult provider, you haven't heard that term unless you've had a kid or if you've worked or probably since school. You're going to be learning about a lot of equipment, and you're going to be learning about a lot of therapeutic procedures that we can be doing with these children and infants, and just what's different between the infants and pediatrics compared to adults. There's a few things that you do need to know, which is, we could talk all day about the differences between the two, but the NPS exam is a very good one. And the next one is rather new, the Adult Critical Care Specialist, or the ACCS. So the eligibility for this is you got to have your RRT and you got to have it for a year. No CRTs can sit for this examination. So this is a big one, 170 multiple choice questions, and you have 4 hours to take it. And this examination is going to be focusing on questions related to providing respiratory care in the adult critical care setting. So these are all going to be ICU type questions. You're going to be having very sick patients in this examination, and you're going to be proving that you know how to care for these patients. And you're going to be getting a lot of questions too about cardiac monitoring, how to tell if the heart is functioning properly, how to tell if it's not functioning properly, what this number means, what that number means, a lot of central venous pressure questions, and how it relates to total fluid balance for a person. You're going to be tested on what's called special inhaled gases like your isoflurines, your pulmonary vasodilators, a lot of these special type situations that you'll only really be coming into contact with during the ICU care of an adult. So this isn't stuff that you're going to be learning about on the floors. You might get that question about a patient's taking an aerosol and needs a blah, 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 but a lot of it's going to be focusing on critical care. So there's another type of respiratory or specialty that is under the umbrella of respiratory therapy, and it's called polysomnography. And these are the guys that do sleep medicine. They do the sleep testing. They work in the sleep lab. They stay up all night. They look weird during the day, but they're testing people to see how well they're sleeping and if they have any sleep disorders. So there's 2 credentials you can get for polysomnography. The first one's offered by the NBRC, which is the SDS, or the Sleep Disorder Specialist exam. And the other one is offered by the Board of Registered Polysomnographic Technologists. It's a mouthful, which is the certified CPSGT or the registered PSGT. And the eligibility for these exams are based on clinical experience, credentials, and graduating a cohort program. Another type of specialist examination you can take is the Certified Asthma Educator, and this is an exam offered through the National Asthma Education Certification Board. So, in order to sit for this examinations, you got to have a licensed or credentialed healthcare provider. So you're a nurse, a respiratory therapist, a nurse practitioner, a physician assistant, a doctor, or a community health worker that has lots of experience teaching patients with asthma how to manage their disease and how to live healthier lives with that disease. And you need at least 1,000 hours of experience to do this. So the requirements are pretty heavy, but it's worth it. And this is a big exam. It's 175 questions. And again, 150 scored, 25 pre-test, and you have 3.5 hours to take this. So the content of this exam is broken down like this. You're going to learn about, or you're going to be tested on the basics of asthma, or what's called the asthma condition. So you prove your pathophysiology. You're going to learn you're going to be tested on your patient and family assessment, which is questions like your 6-year-old comes to visit your office complaining of a cough at night. Mom says she coughs at night, and when she wakes up in the morning, but it's okay during the day. And you need to kind of break that information down and answer what you think is going on there. You're going to be tested on asthma management, so you're going to be getting exam items based on what's called peak flow meters, and you're going to be getting questions related to medication in this category. And what's very important for these patients in all aerosolized medications is administration of these medications and their technique. So you're going to have to be able to tell that patients are taking their medications properly, because most of these aerosolized medications are kind of complex to take, and you need to really make sure the patients are doing it right, because if they do it wrong, they don't get their medication. And you need to prove that you know that. And you need to learn some organizational issues, which are just kind of the generic questions. So to take these examinations, you got to prepare, and there's a couple ways you can prepare. if you didn't sell back your books at school, you can take out those books and read through them and refresh. NBRC has their website with practice examinations for each of these exams that you can take and go through and see how well you do. Maybe identify some areas that you need some practice. You can go over the NBRC actually has the content for this examination online, so you can read through it, see exactly what you'll be tested on, and make sure that you can check off each of the points that say, I know how to do this, I know this, I don't even know what that word means, I probably should go look it up, and you can make your study breakdown like that, or you can take a review class. And there's a couple programs out there. The one I'm most familiar with is called Kettering National Seminars, and this is basically a group that goes around and they provide you with a review course related to any of those examinations that you're going to take. So, and they also offer you the home-based education material, so you can get an audio book and a review book with a study guide, and you can take this or you can take the review class at home, or you can go in person. Usually these cost a little bit to get into, and they're only offered based on groups that request them to come in and teach these classes. And it's a 3-day, 8 hours each day, intensive review. So you're basically going in for 3 days, and you're going to go over everything that you learned in at least the past 2 years. And so it's pretty intensive, and it'll keep, there's a lot of material to remember. And the Association of Asthma Educators also offers a home-based or in-person review that's set up the same way as you request the group to come in, and they'll teach a program for you as long as you have the people that can attend it. So after you get your license and your credentials, you have to do what's called continuing education, and this just means that you're maintaining you're ensuring that your practice is current, so you're not ignoring the new research, you're paying attention to what's coming out there, and you're competent, and you're maintaining your professionalism. And this is provided to the state and to the NBRC, and you need to do both of them. You can't do one and the other. You have to do both. If you forget one, the other one goes bad, and you're going to find yourself in a difficult situation. So you earn these CEs by going to conferences. You can do webinars. I can't offer them for you, but webinars, you can pass examinations. So if you go to the NBRC and take one of these examinations, you'll get, and successfully pass it, you'll get CEUs or CEs for that. You can take college credits. You can attend what's called dinner theaters, where they feed you and give you a little discussion about an aerosol or a technique or a medication or a new machine that's out there. And most states, I'm pretty sure all states now require you to get a little bit about ethics. So you got to get at least your one CE related to ethics, and the rest of it's general practice. But the NBRC requires you to get your CEs based on which credential you hold. So if you have your NeoPeds credential, you got to get a couple of those CEs need to be based on NeoPeds. Or if you have your adult, you got to get a couple based on adult. Or if you have all of them, you got to get a little bit of everything. So you got to make sure you keep your CEs, or you'll lose your license and you'll find yourself out of work, and that's a big red flag when it comes down to you getting a job in the future in case you get fired. So the professional organizations for respiratory, the big one, these are the big guns for the respiratory therapists, is the American Association for Respiratory Care, or the AARC. And they do a lot for the profession and for the individual, which we'll talk more about them a little bit later. There's state societies. Each state has their own society, which you can get involved with as a just a member, or you can get involved in the board of directors and help set up stuff for your state. You can lobby for your governors to, vote a certain way on issues as they relate to you and your profession and the care you provide. You can join up with special interest groups, and some of these are related are disease-specific groups, or there's asthma groups out there, there's COPD groups out there that are involved with multiple practitioners, and there's nursing groups. So there's other ones that are usually the kind of disease or practice specific related groups. And that brings us to the end. Again, thank you for watching. I've got a lot of plans for this channel. We're going to be doing a lot of great things with this. I'm going to be teaching you, hopefully, a lot of good information, or keep you entertained for a little bit. So again, thank you for watching. I hope you learned something. If you have any questions, comment below and let me know. Thank you.